RN-based student whose name was Papa, and she was actually working in Dade Hospital, Dade, no? Anyway, I thought you were the one. So let's start now. I'm going to start with you the psychosocial skill. No, psychosocial skills. The first one. Huh? Okay, introduction to psychosocial nursing for general patient care. These are our learning objectives for today. I hope that I'm going to meet all these learning objectives as I present. Define psychosocial nursing care. Describe the impact of patient behavior problems in managed care setting. This is very important. Describe the role of a patient education in psychosocial care. uh, you all know that one of our main job as nurses would be as nurse educator. And this is the most neglected part also when we are going to consider our practice in the hospital. Most of the time, we do not sit down and spend time with our patient doing health education. This is very important, no? Especially when we are doing discharge planning. When we discharge the patient, most of the time we spend around 3 to 5 minutes only, nothing else. The basic idea is that when we are going to do health education to our patient, we are going to include everything, including the psychosocial aspect of care. Of course, the number four learning outcome will be name the resources the nurse can use when planning for patients across care setting. We should know what are some of the resources that we have in the world. The most important resource I would like to emphasize to you are not material things. In psychosocial care, the most important resource that we would be using will be ourselves. That's why when you are going to meet your patient, interact with your patient, establish your relationship with your patient, you should use yourselves therapeutically. That's the most important thing that you can actually use. All right, so we'll try to proceed now, understanding what a psychosocial health is. All right, psychosocial health encompasses the mental, emotional, social, and spiritual dimension of what it means to be healthy. Most of the time, this is the most difficult thing to see because these are to determine, because these are difficult to see. Only the patient knows the impact of understanding and studying their behavior would actually be impact also our nursing care. The way we give nursing care to our patient is very difficult. For some, like in case of physiological changes, physiological abnormalities, there are tangible evidences. There will always be diagnostic tests that we can actually do. But for psychosocial health, it will be very difficult. It requires observation. It requires looking closely into the action of our patient before we will understand what they are suffering. Sometimes when they verbalize something, sometimes when they are going to tell you something, it will be difficult to understand because they may not be telling the truth. Most of the time, you see, sometimes patient may hide whatever they are experiencing psychologically and emotionally, because most probably we couldn't have established a trusting relationship with them. We have no rapport with them. So they don't trust us, they don't give us whatever they are experiencing psychologically, emotionally, spiritually, among others. You see, it's very complex structure that we have to deal with. It's a complex situation that we're going to deal with, right? Now, psychosocial health is the result of complex interaction between person's history and his or her thoughts about and interpretations of the past and what the past means to him. We have been taught in our college education that before you will understand the condition of the patient, you need to understand the history. Sometimes we are going to look into the history of the present illness. But in psychosocial care, we are going to extend more. When we are going to look at the history of the patient illness, sometimes we are going to look in months or maybe in years. But in psychosocial care, we have to look past the life of the patient, the different stages of life of your patient, including childhood experiences. Because in psychology, there is a saying that says, tell me what your experiences are, and I can tell you who you are. The person's personality is a product of his experiences in the past. Sometimes it's very difficult because our patient do not have any recollection at all of his past or her past, making it difficult for us also to understand them. Understanding patient requires patience, requires complex understanding of the past of your patient. We have to have some sort of theoretical knowledge in terms of psychology, theoretical knowledge in terms of different behavioral theories, like in the case of Eric Erikson and Sigmund Freud, so that we can always go back to the stage of development where the patient was. That is the thing that we are going to look into. Like, for instance, the behavior of a person when he was a child would be different from the behavior of a person when he is adolescent or when he is actually on his late stage of life. So these are different, and the different experiences that they could actually have could be varied also, and the way they appreciated their experiences could be different also. That's why every single individual do have unique experience. So we cannot always, let's say, assume that the experience of one is the experience of others. That's why when we are going to tell and we are going to take care of our patient, we must have to make it sure that we do individual and holistic care. Holistic means to say we're going to look into different dimensions, psychosocial aspect, much more. That's the reason why that is actually our subject for today. Of course, you're going to look into biological, physiological, and most of the time, since this is your subject, we're going to look into psychosocial aspect of care. If we're going to look into that, we look into emotional health, that is pertaining to feelings, emotions, affect. Social health, the way how the patients would have related to his family members, to his community, to his peers, to his professional groups, among others, to his mental health, his cognitive abilities, the way he thinks, and of course, spiritual health. This is very important because every single individual is considered as a spiritual being. So we're going to look into this beingness of an individual. You know why this is very important? Uh, this is the thing that will be lost last whenever everything actually ends, whenever everything is gone. Like, for instance, you cannot anymore utilize defense mechanism, coping mechanisms could actually be lost. Also, here comes a person would only be dependent on spiritual help or spiritual being in order to hang on with their lives. No, so I'm going to discuss as we go on about this. No, any questions so far? Am I very fast? Do you follow me?
Yeah, we are follow. Thank you, Doctor. Yes.
You're following me. Just
Yes.
stop me whenever actually I have to record, no? Whenever you have questions, whenever you have ideas, whenever you would like to tell something, I'll appreciate that. You have to tell it, no? You can actually share that to your classmates. After all, there are only four of us here, okay? Whenever there are questions, you may ask. Whenever you would like to say something, you may tell. I really would like to have a very interactive class where my students would always participate. Do you follow so far, right? So shall I go ahead? The slides are also okay, isn't it? So it can be projected on your screen, right? Okay. So let's see. We are going to look, you see, what is psychosocial health? This is the first thing that we are going to look into. Yeah, of course, we know already the four dimensions. Now let us try to look into the practical application of psychosocial health. What do we mean when we say a person is psychosocially healthy? person may feel good about themselves. Definitely. As if there is no problem. As if everything is under control. You have a very good self-esteem. You have a very good self-worth. You have a very good relationship with other people. You are one with your God. You have a very beautiful experience with God. Okay? That is the thing. Whenever there were problems, there are going to be problems, you can always solve them. You feel good about who you are and what you are. You're very happy with your life. You're very happy with your work. You're very happy with your family. Okay? That's psychosocially healthy. That means only one thing. You have the ability to adjust. That is the thing that you're going to look into your patient also is very important. Once in a while, we do have some problems, medical and psychological problem. That's why we are in the hospital. That's the thing that we have to solve. That is the thing that we have to find solution as nurses. Another one, feel comfortable with other people. When you are with other people, you are at ease. You see, because you know your capacity, you know what you are capable of. You don't feel insecure. You don't feel so threatened. You have the ability to interact with them. You're not afraid to give your ideas. By the way, what we're actually talking about today, would be applicable to you also. You see, after all, we are human beings. After all, we are one and the same with our patients. Our patients are human beings. We are human beings. They have psychological health. They have psychosocial health. We also have psychosocial health. And we need to take care of that. Number three, control tension and anxiety. Anxiety is a reality of life. We're going to understand that on our next chapter. Everyone encounters anxiety almost every day. Now, the anxiety must be under control all the time. You see, if you are going to tell me that you do not have any anxiety at all, then there must be a problem with you. If I'm going to tell someone that I don't have any anxiety at all, then there is a problem with me. The reality is we are all anxious. Yeah. But of course, we are anxious in any way in a certain degree. There is what we call as mild, moderate, and severe. Every day, every single day, we are doing that. We are having mild anxiety. All right. But of course, this anxiety is under control. Like for instance, what brings us anxiety? We are late. You see, we are anxious. Number two, maybe you have missed a phone call. Or number three, you have missed your deadline. Number four, you were not able to be meeting your director of nursing on time. This will bring us mild anxiety. You see? But of course, this can be under control. If you can control that, then you are psychosocially healthy. We are able to meet the demands of life. As a human being, every single day, we are always tested in life. There will be some problems. Here comes another call telling us another problem. But of course, we have to solve. Just like what we are doing in the ward, we are always solving the problem of our patients. Now, with our lives, we have also our problems that we have to solve. And we are always meeting that. Of course, paying credit card, paying your bills, going to the market, preparing your children to go to school, helping your children to do your assignment. These are all the demands of life that could actually be interfering with us. Because, sometimes every single day, we're going to have priorities, but within our priorities, there will be some interference. That will be the demands of life. If we're going to assume and if we're going to meet the demands of life, then we are perfectly normal. We are psychosocially normal. We can be able to curb hate and guilt. Now, hatred and guilt are two negative emotions that would actually denote negative experience. If you do have these negative emotions and negative experience, chances are you are maladjusted. Therefore, if you are maladjusted, you are psychosocially unhealthy. That is the point. That's why it's okay also as a normal being to hate. It's okay also as a normal being to feel guilty, but of course, it will not interfere. This feeling of hate, this feeling of guilt would not interfere with our daily function. We are able to cast them away, we are able to curb them, we are able to forget them. That is actually the real experience that we have if we are psychosocially healthy. Of course, we have to maintain a positive outlook. You know, this time, especially in COVID-19, everybody seems to be depressed. Everybody seems to have some issues of life. Everybody seems to be running after something. Everybody seems to be afraid of something. Everybody seems to be looking gloomy at their future. But as a person, as a psychosocially healthy person, we are capable of looking positively in life. We have a very good disposition. After all, we can always say, this too shall pass. See? If we can actually say that, then there must be something that tells us that we have to do that. There must be something in our experiences that would make us resilient to whatever negative experience that we may foresee in the future. That's the reason why we are always looking positive like our future. We're always believing that the future is good for everyone, for you and for everyone. That is the meaning of maintain positive outlook. But of course, value diversity, especially in the United Arab Emirates. You see, United Arab Emirates is a cauldron of culture. Is a culture of cauldron of different nationalities. There are various nationalities. There are different people here. So we respect one another. The moment we will not impose our will, the moment we will not impose our culture, then something positive is happening to us. We could be psychosocially healthy. The moment we learn how to accept them, whatever they are, whatever they may be, then we are definitely psychosocially healthy. You know, understanding our patients require understanding ourselves first. So that's the thing. If we are going to look at the patients like that, looking into helping them how to become psychosocially healthy, we have to look ourselves first. We must have to make it sure that we are psychosocially healthy also. Okay? We have to respect them. Nurses are very good at that, no? We respect the different culture, cultural diversity. Appreciate and respect nature. You have a very good appreciation of nature. You have to follow the rules. You know how to follow the rules. You do not even throw garbages somewhere else, especially small things. You see, if you're going to eat candy, for instance, of course, there will be wrappers. What are you going to do? Other people who do not have respect with nature, just throw it away. But if you have respect to nature, then you are going to put that in a packet and later on place that in a garbage. Simple way. That way will always define your psychosocial health. You see, there are so many things, you know, especially like for instance, if you have seen tap water running on your faucet, other people would actually say, who cares? Especially when that faucet is not their faucet. Faucet is the faucet of their neighbor or the faucet is the faucet of the hospital. When they see the water that's running, they just don't care. But if you are psychosocially healthy person, you have to do something. You feel so responsible with nature. So what do you mean by that? You have to turn off the faucet. You see, that's one way. That's one qualification of becoming psychosocially healthy, right? And of course, as a person with good psychosocial health, you are helping other people to make themselves better. Sometimes altruism, you know, when you see altruism, you don't care about yourself. You care to help other people. You see, you make other people make their lives better. You enrich the life of other people, especially if you're going to be a manager. If you're a manager, sometimes you do not look negatively on the work of other people. You blame them, you try to check on them all the time as if they didn't do anything. we have to be very positive. We have to help them do things. We have to help them become better. We have to help them how to have a good life, a good look at themselves. Sometimes we don't look at ourselves in order to give. Instead, we look at others so that others will live happy. If they are happy, we too are happy. That is the fundamental aspect of a very healthy psychosocial health. If you have all this, then there is no doubt that you can always give psychosocial care to your patient. This is a requirement. If you have a problem, then how can you give? If you have concerns, then how can you give? We cannot give what we do not have. If you do not have psychosocial health, then you cannot actually give psychosocial well-being of other people also. So giving psychosocial care to patients start with ourselves, understanding ourselves and becoming psychosocially healthy. That will be the main point. That is the thing that I am attempting to let you understand and let you learn for today. I hope it will always help you. It will help you in your future practice as nurse. Moving forward, let's try to look into uh, our learning outcome number one. So, what is psychosocial nursing care? What do we give? How do we care using psychosocial help? What do we do? Now, always take note of this. Every day, look at that nurse. Very simple smile. A gentle approach to the patient will actually guarantee a positive outlook of the patient. We can influence them. We can actually make our patients, let's say, at ease to us. Our simple and gentle smile will always affect them physically, mentally, and psychologically. And of course, if we are going to smile, definitely we can actually deliver quality care to our patients. Every day, nurses are confronted with patient problems. There are so many problems. When you say problems, these are all negative. Of course, we do not want problems. But as human beings, problems are there, keeping on influencing us every day. Problems may either keep us negative or help us to become positive. Our outlook may be boosted or our outlook in life may actually be decreased. That is the thing. Crisis also will be there. And these are all be falling into psychosocial. And of course, we have to deal with that. We have to help our patients deal with that. The moment the patient is admitted in the hospital, always take note that their normalcy of life is already affected. Why? They are going to be separated from their family members. Remember this, every single patient that we admit in the hospital do have families, whether they are single or married, they have families. They may be children of parents, or they may be father of children, they may be husband or wives, other families. They are member of a family. So we are going to uproot them from the community where they are in. So therefore we separate them. Definitely, when they are in the hospital, there is already a problem. There is already psychological concern. There is already psychosocial concern. And who can actually help them deal with this psychosocial concern? The nurses. Why nurses? Because we are always in contact with them for 24 hours. We should have to have a meaningful and positive relationship with with the patient. No, we call that as rapport, isn't it? That's why we call it psychosocial. Social means connection. Social means relationship with somebody else. If we are going to have positive relationship, then the patient will become psychologically or psychosocially healthy. We address already their psychosocial needs. Understand? Do you follow?
Yes, yes.
You see, nurses often must care for patients with the following. Number one, take note of this. The moment you are going to admit the patient, they are already separated from their family. So the first problem supposed to be will be about anxiety, will be about psychological health. Therefore, we are going to deal with them with the following intense emotional responses to illness. They're afraid what kind of illness they have. Right now, for instance, if you are going to be or somebody is admitted because of COVID-19, what happens? They must be under crisis. Even a doctor or a nurse, if you say you have COVID-19, it is something else. We're afraid. We don't know what's in store for us in the future. We may die anytime. So there is uncertainty, there is fear, and fear is a negative emotion that will actually influence our psychosocial health. Definitely, if we're going to have that, then there will be imbalance. And with the if you are going to, if you can recall your fundamental nursing, fundamentals of nursing, the health and illness continuum, one will be tilted on the other side, then there will be illness. That is the thing. Okay, we tend to balance this. That is our main idea. Our main purpose why we take care of our patient. We are going to maintain homeostasis. Homeostasis requires psychological well-being of the patient. Number two, the personality styles that make care difficult. Every single individual is unique. Every single patient, since they are human being, is unique. They have their different experiences that made them who they are. Sigmund Freud mentioned that an individual's personality could have been developed at the age of 7. So the experiences of that person, the experiences of that patient at the age of 7 is the one that dictated his personality now. If he is difficult now, then most probably he could have difficult past. And if we're going to look on the point of view of Erik Erikson, personality is actually developing through time until such time that you're going to die. No? So that's the thing. So it will be more positive and it will be better. But the thing is, we do not know every single patient that we may actually have because every single patient they have different experiences. Every single patient came from different parts of the community. Oh, and the way they treat them in the community would actually make them who they are. So that's why we are making our care more difficult. Sometimes you see there are people who are actually easy to deal with, and there are patients who are difficult to deal with, full of anger. Sometimes they do not want to smile. Sometimes they do not talk to us. That makes our experience difficult, no? Of course, we have to find a way. So on the next chapters of our psychosocial nursing, I'm going to teach you how to deal with that. No, we do have psychosocial skills. This will actually help us to overcome all these limitations that we may actually have. And of course, the next problem that we may actually encounter will be psychiatric disorders, diagnosed or undiagnosed. The most difficult thing to deal with will be undiagnosed psychiatric disorders, like anxiety disorders, like in the case of personality disorders. Most of the time, since these people can live with the society, they may actually be having some difficulty. We may have difficulty diagnosing them and understanding them. Yeah, especially in the case of personality disorders. Anyway, we come into that as we go on. Then, of course, stresses and family problems that affect patients' reaction to illness or hospitalization. Come to think of it. No, come to think of this one. If the patient comes to the hospital, they are poor, no insurance. What do you think will happen to them? They're worried every single day, every single second, isn't it? They are worried about payment. They are worried about if they are head of the family and and that patient is working for the sake of family. Then every single day that the patient is in the hospital, she or he is thinking that no food will be given to the family. So that's the thing. So we have to look into that. That's the reality that we have. So as a nurse, we are confronted with this problem. As nurses, we are confronted with this problem. And of course, we have to deal with that because that's the reality of the profession that we learn to embrace, that we learn to accept. Whether we like it or not, we should know how to take care of them. That's why you're very lucky because we are introducing in this university psychosocial nursing care. In psychosocial nursing care, we do not only look into patients with psychiatric disorder, we are going to look into a whole bunch of patients that we may actually have. After all, this is a part of who we are and what we are as nurses. Okay, moving forward. Psychosocial care is the culturally sensitive provision of psychological, social, and spiritual care through therapeutic communications. As I mentioned to you earlier, the best resource that you may use as a nurse would be yourselves. You can use yourself therapeutically. You can always communicate with the patient. The way we communicate with them is called therapeutic communication. We will learn later on about that verbal and nonverbal therapeutic communication. How are we going to help our patient? With the use of ourselves only, with a smile, with a touch. You see, simple touch to our patient will mean something. Simple smile without to our patient will mean something. We'll be able to touch them. We'll be able to change their outlook in life. If their outlook in the morning is very gloomy, very sad, very bad, if we smile at them, all of a sudden they change. So that's the thing. That's how important it is. Now, nurses perceive that psychological care consists of providing holistic care, spiritual care, support to the patient and family members, and showing empathy. Holistic means everything. We have to look at that. We do not dichotomize. We do not compartmentalize the care of our patient. If we're going to give physical care, we also need to give psychological care to our patient. Oh, well, we get used to that. Most of the time, we do some sort of physical care, just like cleaning the wounds, bathing the patient, giving injection, delivering or giving IV infusion. These are physical care. As we do that, we also give psychological care because the way we approach them will always be using therapeutic communication. Just simply saying, "Good morning. How are you today?" You talk about the weather, then you smile, you touch, you feel so jolly. That is therapeutic communication. You see, and if you're going to use that, if you're going to use that technique, you will be able to help your patient, and that's psychosocial care. You see, so we may never know, but we keep on doing already psychosocial care. All right. So as a nurse, we are responsible to deliver holistic care to our patients. Okay. Any questions so far? Everything is clear?
Yes, it's clear.
You want to add some more? Shall I continue?
Yes, please.
Okay. All right. These are some of, whenever we are going to encounter patients, no? These are some of the nurse's possible reactions, right? This is very important because we are going to look into a factor whose importance cannot be overlooked in psychosocial care. That is awareness of one's own reaction to patient behaviors. This is the thing that I really would like to emphasize. As a nurse, we are human beings. How do we react? You see, we know for a fact that in the world, sometimes there are patients who are very annoying, right or wrong? No? Very annoying. Why? We are at the nurse's station. Then one patient would keep on ringing the bell. Do you have patients like that? They keep on calling you, right? Are there patients like that? You have patients like that. Nurse one, nurse two, will you please come? I need your help. You see? How do you react? Maybe at first, it's okay. Dutifully you go. Second, ringing of the bell, maybe you go. Third, fourth, maybe there is something else. How are you going to react? You see? That is the thing. We are going to look into our own behavior first. We have problem at home. We go to the work. We work. What happens? The problem at home is not left behind at home. We carry that at work. How are we going to become therapeutic with the patient? So this is the thing that we are going to look into. We should be aware of what's going on with our own behavior so that we can actually check and we can always react positively on whatever the needs of us, our patients will be. Okay? Now, these reactions, take note, will always influence our patient-nurse relationship. No? If we are happy, we can always be jolly with our patient. If we are not happy, that is the thing. Supposed to be, we will not be bringing any problem to the hospital. Once that we are in the hospital, we are nurses. Always take note of that. But chances are sometimes nurses would display their humanity. That means to say they are also authorized or allowed to get angry. But when you are going to the hospital, you are not supposed to be that way. You should be aware. When you are in the hospital, you are a nurse trained to handle your emotion. Therefore, you can always maintain your therapeutic relationship with your patient. Positive, therapeutic, positive nurse-patient relationship. No? All right. And of course, take note, our emotions can hinder the relationship that we have. What is actually the meaning of hinder? Can thwart, can middle, can stop, can influence the relationship that we may establish with the patient. You know, a nurse can never be a nurse without establishing nurse-patient relationship. This is the most important thing that we could actually have. All the aspects of care may be lost except nurse-patient relationship. This is the most important thing that we may have as nurses. You see, we use ourselves therapeutically, then after that we will establish nurse-patient interaction, then everything will follow. The patients will always look positively. The patients will always accept whatever we do to them. Because sometimes convincing them to do something will be very difficult. So that's the thing. All right. So now let us try to look into recognizing the influence of these reactions will always help us. No? We need to understand what we have. So we need to look into it so that we will be able to check. Number one, if we increase awareness of the reactions that influence objectivity, then we will always give psychosocial care to our patient. We have to check. We have to have an awareness of our reactions, right? Number two, identify reactions frequently experienced by other nurses to ease feelings of guilt and resentment, especially in the hospital. As I mentioned to you a while ago, I give you an example in the hospital a while ago. You see, patients who keep on calling you, who keeps on demanding you, relatives or the patient who keep on complaining about you. Sometimes they go to the nurse's station. See, if you miss something, they claim something. So you are actually angry with them. So that's the thing. Against all odds, no matter what, as nurses, we should always stay positive. That's why we need to identify this reaction within us so that we will learn how to remove this within us, especially resentment, anger. Resentment is a negative experience that denotes anger, that denotes hate. You know, hate. Hate is a negative experience that is very powerful, that can influence and destroy your day, destroy your therapeutic relationship with the patient. You see? Number three, increase understanding of colleagues' reaction to enhance the work environment. Sometimes we have to observe what's actually going on in the hospital. It will be very healthy. We must not be condescending when we observe our patient, our nurses, our colleagues. We have to talk to ourselves, or we have to keep our observation to ourselves because sometimes we will find mistakes, and these mistakes, if this cannot be life-threatening, it's better to keep within ourselves so that we can actually say, this is the mistake that he committed. I may not committed. We learn from that. But if you have a very good relationship with the fellow nurse, then you can actually tell them. See, that's the thing. So we have to observe whatever they actually do. And sometimes there are nurses who are better than us in handling situations, especially when they are under pressure. Let me call it grace in between, in the midst of pressure. No? So you can actually make everything under control. There are actually nurses who are very good at that. They are always maintaining their grace under pressure. You see? So we will learn from them. We will learn how is it that there are nurses who are very jolly, who are all the time smiling. How come and what are their secrets? You see? So we have to learn. The most important thing that we will assume is that we should learn to understand and accept our inadequacy. We are not perfect. No human being is perfect. I am not perfect, as I mentioned to you earlier. I must still learn from somebody else. Okay? So moving forward, facilitate self-support by reducing self-criticism and reinforcing skills. This is very dangerous, especially if you're looking down on yourself, if you feel that you are inferior. When you say self-criticism, this is again always negative. These are threats to psychosocial health. Imagine you're going to tell, instead of doing your best to become a best nurse that you could be, you would always say you're good at nothing. You are not that. You cannot do that. You cannot do this. If you are actually doing that, then there must be some problem with you. There must be some problem with your experience. So as a person, you should know how to control that. This is the thing, no, that you need to look into. As a person who understands psychosocial well-being, then you will be able to check. You will be able to help yourself. If you cannot help yourself, then you can go to your hospital psychologist or hospital psychiatrist. They may actually be helping you. You see? Maybe we are sick. Maybe we are actually bothered. Who knows? No? Sometimes we are bothered. Sometimes we do have some problems that we cannot check. Okay? But the most important thing that will actually help you is do not put yourself down. Okay? If you allow yourself to be put down, then you will be down. Remember this, as I keep on telling my students, no one can put anybody down except yourselves. The moment you're going to put yourself down, then there will be a problem. And that is self-criticism, putting yourselves down. It has no place in psychosocial health. Of course, it's good that we need to accept our weakness, but we don't do self-criticism all the time. Self-criticism is good if you can actually check that because it will give you your limitations. But if you keep on doing that almost every single day, then there is a very big problem. Okay? Select better assessment tools to identify patients' dilemmas and response. As I mentioned to you earlier, the most difficult thing to understand will be the behavioral and psychosocial problem of our patient. Sometimes, if we will not observe what they are doing, then we will never find. Because most of the time, the patient would actually tell a lie. As a psychologist, this is the thing that I observe. Since a person translates what he thinks on the action that he actually does every day, this is the thing that we have to look into. There is a way to know what is in the mind of your patient. What is that? You closely monitor and observe his actions. Actions speak louder than words because words may be lies. Actions cannot actually tell a lie. Actions will be translated initially coming from what the person thinks. So this is what we observe. This is how we interpret patients' thinking, looking at patients' action. That's how we read people. That's how we understand people. And of course, as a nurse, you can always do that. Okay? Recognize how personal reactions to patient can influence assessment, no? Planning and effective intervention. This is the thing that I'm going to emphasize, no? I am going to remind you that as nurses, we have no right to be choosy. We have no right to choose our patient. But human as we are, sometimes we play favorite, no? That patient is better than this patient. That's why your reaction to individual patients will always tell you or influence your assessment, influence the care given, among others. You see? But as a person, as a nurse, we need to guarantee that every single day, every single patient in the ward, every single patient under our care will actually be given quality care. No distinction, okay? No preference. If you are psychosocially healthy nurse, then you could always do that. Remove your prejudice. Cultural diversity will be respected. As I mentioned earlier, isn't it? Respect of cultural diversity, because you will be respecting others. So that's the thing. See, the bottom line is to summarize what we have discussed in recognizing the influence of these reactions that as a person, as a nurse, we should be aware of what's going on with us so that we can actually effectively care for our own patients. Okay? All right. Can you follow? We have 10 more minutes, no? Are you tired?
It's okay,
Are you
sir.
tired? It's okay.
No,
So
doctor, we can't tolerate.
Okay. I hope I'm not boring, you know. I hope you are taking or learning something, no?
Actually, because it's the first class for
Yeah.
us, so we are excited until now.
Okay. Keep that excitement because that will motivate you to
Yes,
go on. Especially you have 2 years ahead, no? 6 months plus 2 years for your master's degree. The moment
yes,
that you're going to reduce that excitement, then there will be a problem, right?
yes.
So
Inshallah, we will keep this exciting until we finish.
yes, that's very good. That's a very good attitude. Then it actually assumes that you do have a very good psychosocial health, right? A
Yeah.
positive outlook in life. Okay, so let's try to move forward. So let us try to look into the role of psychosocial nursing in managed care settings. So most of the time, if we're going to look into our setup, there are so many things, no? Our hospital is supposed to be for acute case only, all right? Except the tertiary hospitals or, or specialty hospitals where long-term stay of our patients will be there. Acute hospitals, acute patients will actually be taken care of in our hospital for a number of days only. Then later on, they will be transported or transferred to the respective communities, to the respective house. So let us try to look into this. What are our role as nurses? What is the role of psychosocial nursing in managed care settings? So let us try to look into patient safety. It's our responsibility, whether we like it or not, no? Patient safety. This must always be number one. In psychiatry, this must always be number one. Wherever you go, in medical ward, patient safety is number one, right? See, that's why when the patient is actually unconscious, there must always be side rail so the patient may not encounter accident. Zero tolerance to accident because we may compromise the life of our patient. So much more in psychosocial nursing setup. No, psychosocial care incorporates these patient safety measures as a routine part of practice. Why? By means of maintaining open communication with the patient and healthcare team. In psychiatry, and in psychological health or psychosocial health, there is always a threat, especially if the patient is diagnosed, the threat of self-harm on the part of the patient. What do you mean when you say self-harm? Suicide, you see? And of course, hurting others, right? Homicide. So this is the thing. So it's our foremost duty to keep our patients safe, and at the same time to keep the staff safe also. So we have to have this open communication with our patients if they can communicate. The reason why they have this open communication, because sometimes if the patient is quiet, we do not know what they are thinking. See, before we know it, it's too late. Most of the suicide cases are like that, no? And you can always tell that, you can always have that experience in the world, no? I believe there are so many cases of committing suicide, particularly in some areas of the world, no? Especially when the patients are alone, they have no relatives, when they have been afflicted by diseases, terrible disease like AIDS. Sometimes they would rather kill themselves rather than stay alive. So patient safety is our first and foremost concern. Then another very important role that we have to look into in managed care setting will be the lifespan issues. We have to understand every single stage of development of our patients. No, as a nurse, it's our duty, because the way we take care of patients will be different. The way we take care of patients who are children is different from the way we take care of patients who are adult. Adult will be different from the way we take care of geriatric patients, right? Therefore, if we are going to look into depression, for instance, depression may be prevalent among adolescents and old age, but not to adults. Okay, so this is the thing. Problems such as depression and grief affect individuals differently in each stage of life. So adults do have a strong tolerance to depression. Adolescents may not have any strong tolerance to depression. They may succumb to it, especially also for old age people, because they may actually be despairing. If you are going to understand Eric Erickson's stage of development, it states, no, the person may actually be on the state of despair. So they may kill themselves. This is the thing. They may be depressed, then after that they may kill themselves. So they have different appreciation of depression or any other mental health issues that they may encounter. Childhood, adolescence, and all these are times of particular vulnerability to psychosocial dysfunction. Experiences of every single individual as they grow will always tell how they can cope with the situations that they actually have. And of course, other than that, the different stages that they are into. That's why I keep on telling my students, if you are caring for patients who are adolescent and or old age, extra careful. You have to look into something else. You see, you have to you have to watch out on the reaction to depression, on the reaction to despair. But if they are children, it's very easy to take care of them. No, they have, as I mentioned to you earlier, high tolerance to depression. They may not be depressed at all, especially if they have a very beautiful and good upbringing from their family members. So that's the thing. All right. Moving forward, collaborative management. As the word implies, co-labor, work together. Now remember, in the workplace, we are working together with different professionals. But the question is, when are you going to need help? Always take note, no, that the nurse also need to know when work needs to be shared or delegated to referrals. You cannot assume all responsibilities. You see, there must be a way to do referrals to your patients also. Yeah, other resources will include physicians, advanced practice nurses, in the case of United States, pharmacists, sometimes priests, imam, no, dietitians, and others, depending on the specialty and setting. Now, knowing when and how to access them and work effectively with them will also improve the patient outcomes, definitely, and enhance the working environment. No, a working, multifunctional, multidimensional, collaborative work will be the best, always the best for our patients. Okay, I will stop on the next one, patient education, no? Because it's already about 3:30 and Dr. Romeo will come next. Now, patient education is one way, sometimes this is the most neglected part of our practice. let me ask you, tell me honestly, how many minutes do you spend? I'm not going to judge you. I'm just actually talking about reality. How many minutes do you spend with your patients doing health education or patient education? Do you do that?
It depends on the patient situation.
Yes. But every day, do you do that to your
Again,
patients? All? Do you do that all to your patients? Do health
sometimes
education every day?
we don't have time. Sometimes it's if we are busy,
Yeah.
we cannot do all.
Exactly. This is the thing. This is actually the most neglected part of our practice as nurses. Supposed to be almost every day, we are going to use health educations. Yeah. The moment the patient is admitted from the admission office, from emergency, health education must be started because you know what? The patient may be confused. The patient may be afraid. The patient may not know what's actually going on. You see, the moment that they are separated from the family, there will be problems already. Nursing problems, psychological problems, psychosocial problems, as I mentioned to you earlier, anxiety will be there, fear will be there, isn't it? So patient education is an important component of psychosocial care. No? We have to teach them how to be resilient. We have to teach them how to understand the situation that they are into. Nurses are required to incorporate appropriate patient education in their practice in order to provide adequate education, the needs. The nurse needs to be aware of how psychosocial issues will actually influence learning on the part of the patient. Remember this. This is the reality. The moment the patient enters the hospital, the patient do have psychosocial problem already. Why? Because you are separating them away from their families. That's the thing. The moment you separate any individual from their families, then anxiety comes, then fear comes, then fear of uncertainty will actually come in and sit in. Therefore, there will be some psychosocial issues that you may encounter. Okay? I will be sending you all these PowerPoints and all the textbook. Did the dean already give you the textbook? I believe she discussed with you the course syllabus, right? Hello? You're still there?
Yes,
So I will be sending you all these PowerPoints so that you may actually use them. And I will be sending you also the books that I will be using, okay? So that we can actually be in sync, so that you can actually do advanced reading also. Don't worry, it's free, no?
yeah.
I will give you 3 books so that you can actually read. Okay?
Okay. We
All right.
appreciate.
Yeah. Okay. So there are questions? Any questions?
No,
No
everything.
questions. So we are good to go, no? Thank you so much and nice meeting all of you. To the dot, no? All right. Have a good day, everyone. Nice meeting you. I'll meet you on Thursday, okay?
Okay.
الحين عندنا كلاس بعد ولا خلصنا؟
هي عندنا.
يا أخي أنا رقاد.
كله والله فينا رقاد. عاد تونا في هالكلاس اصلا كنا نتغدى. خلاص الحين ام الرقاد.
طالعين من
باقي
الدوام
كلاس
ولا؟
واحد.
خلصت دوامكم ولا بعدكم؟
لا والله منيرة شو اسمه ضبطي لها الجدول وقت الدراسة ما عندها دوام. أنا دوامي رسمي بس حاليا أجازة.
يلا زين، أنا دوام المساء هالأسبوع.
الله يعينك. شفتات صح؟
شفتات هي. أنا تراني أنا أتعامل مع مساجين.
يا الله.
أنا ماسكة عيادة السجون يعني، فعشان شي ساكتة صاخة. حالات اللي أتعامل وياهم أعوذ بالله.
عيل انتي صدق تحتاجين هالكلاسات
فعلا
النفسيات
نحتاج
اللي عندك.
وايد. بروح اسوي لي كوفي.
سيري تحتاجين صراحة.
شكله ما في حد.
طرشت لنا مرة ثانية نبدل هذا
شو اسمه
اللينك.
اللينك.
ايه
يلا بندخل عليه، نطلع من هاللينك يعني.
ايه
يلا تمام.
أروح. تعالي تعالي تعالي. Only me and you, doctor? I actually, they still in that link. I told them, Sheikha, she came. Yeah, Munira, now she will come. معلش سكر والمايك مفتوح ولا كده أنا وشيخة نسولف. بعدين الدكتورة طرشت واحد ثاني، طرشت في اليمين واحد ثاني. بس دقيقة داخل